Hello, lovely people. It's another episode of White Coats Diaries here on Tech TV, and of course, my name is Antoinette Enchi. Remember that our partners are the University Hospital Health Science Students Association and the Science Students Association, all of KNUST, and obviously our sponsors, proud sponsors, are ICCAP, who has given us this wonderful premises to use for this episode and all the other episodes as well. Remember that you can watch us live on Tech TV Live on YouTube, and you can follow us too on Instagram, Facebook, and Twitter at Tech TV GH. You can also get regular updates on our WCDGH pages on Instagram, Facebook, and Twitter as well. Today we are talking about contraceptives, and I have a wonderful lady here to help us do the discussion. But before I introduce her, let's listen to what people have to say on Viewers Point.
To me, I feel if you feel your condition, you must take a contraceptive. That is where you take it. For example, a student, maybe you're working at a bank and you don't want to get pregnant at a time, you use it. But it's not like anyone can just use it unless you decide I have to use it.
Like in religious way, students are not like those who are not married are not supposed to have sex in the first place. So if you like link it to religious view, it's only married couples that are supposed to use contraceptive.
Apart from compact disc, what does CD mean?
CD. Condom. Oh.
Aside compact disc, when you hear CD, what comes to mind?
Condom.
Interesting comments there by our viewers. Thank you so much for your comments. Keep them coming on our social media pages. Before I left, I mentioned that we have a wonderful lady with us to help us with the discussion for today, and that is contraceptives. And she's the person of Laurentia Aticho. I got it right?
Yes, that's right.
Yeah, she is a fourth year BSc nursing student. Welcome to White Coats Diaries, Laurentia.
Thank you very much.
How has it been? 4 years in school, final year wrapping up.
4 years in school, wow, there's a lot. But by God's grace, we are wrapping it up and we'll finish strong.
Are you going to miss school?
Yes, of course. Friends and some events. We'll miss school.
I know, right? Don't worry, you can always come back. Okay, so you're talking about contraceptives, Laurentia, and you are a nursing student, so you're just perfect for this topic. What are all our contraceptives, if you had to explain to us?
Thank you very much for the question. Now, when we say contraceptives are devices, methods or procedures we use to prevent pregnancy. Basically, that's it. Even the name suggests what is that? Contra, against conception.
Oh, okay.
Yes, against pregnancy. Okay. So that's what it does. Yes.
So in your definition, you talked about methods, right? So what are the methods or examples of contraceptives?
Okay.
We have.
Yeah, we have a lot actually. There are a lot on the market right now. There are about 15 of them actually. Yes, we have the hormonal, the non-hormonal, and then we have the barrier method, and then we have the natural contraceptive.
Okay.
Yes. I want to elaborate more.
Yeah, I also want that.
For the hormonal contraceptives, as the name suggests, it contains hormones.
Okay.
And these hormones, the basic hormones in these ones are the estrogen and then the progesterone. Those are the basic hormones in a human, in a woman's body.
Okay.
Yes, and this helps to maintain the body of the woman. And as this name suggests, they regulate the menstrual cycle of the woman.
Okay.
Now, what the hormonal pills, what they actually do is that they either prevent the release of an egg, the release of an egg, or they make the environment of the uterus very inhospitable for that of a fertilized egg. Yes, or they make traveling of the sperm to the egg very harsh. It prevents the sperm from traveling to the egg. Yes, those are basically what the hormonal contraceptives do. And examples are the mini pills, as in the 28-day pills. Yes, some are combined. That means they contain the estrogen and then the progesterone. Some are only progesterone only. Yes, and then we have the injectables, which are injected. Sorry. injected into the arm of the woman. Yes, and she has to do that every 3 months.
Okay.
Yes, and then we have the intrauterine device.
Okay.
That is placed into the vagina of the woman. Yes, to prevent conception.
Okay.
And then the non-hormonal methods can also be called the barrier methods. Actually.
Okay.
Yes, and then we have the male and female condoms.
Okay.
Yes, the male and female condoms.
You know, I was about asking that why is it only for women? Because you kept on saying woman.
No,
so
no. We have the male condom and then the female condom.
Okay.
Yes, we have the male condom and then the female condom. And when we have the diaphragm or cervical cap that is inserted and it covers the surface of the woman.
Okay.
It's a cap. Yes, and then that's for the non-hormonal one.
Okay.
And then we have other ones like the spermicides.
Okay.
As the name suggests, spermicides, they kill sperms.
Yeah.
Yes. So as the sperms get there, it just kills it. Yes. And then we have the natural method of contraception.
Okay.
Yes, that's when the woman monitors her menstrual cycle to know when she's fertile for sex or when she's infertile. And then one for the men too is the coitus interruptus. Okay. Yes, during sex, before he ejaculates, he withdraws his penis from the woman and then ejaculates somewhere else so that the sperms doesn't get to the woman. Into the woman. Yes.
Is there any best method among all that you've talked about?
Best method.
Yes. If there is.
Actually, we have. Yes, there's actually one that is very common, the emergency contraceptive.
Okay.
Yes, that one is also hormonal pills actually. And it's as the name suggests, emergency. After sex, you take it. And then it based on its mechanism prevents pregnancy. Yes, it's effective, but it's effective when taken the earlier the better.
Okay.
As you see it, yes. Immediately you have sex, an hour or two, you should take the emergency contraceptive.
So immediately there's an emergency, you take the emergency.
Yes, yes, it prevents pregnancy. And one other one that is found to be very, very effective is the IUD, the intrauterine device. Yes, they claim it has 99.9% effective. Yes.
Why do contraceptives fail sometimes? Because I was having some chats with friends before I came here, and one was like, ask the lady, why do contraceptives fail? So I'm asking you, why do contraceptives fail?
Okay,
sometimes?
Thank you very much. Yes, the question is, why do contraceptives fail sometimes? Now, contraceptive, as any drug, can fail. Now, let's take the 28 days pill. It's supposed to be taken at particular times of the day. Now, if you choose today, I'll take it at 1 p.m. Every day it must be taken at 1 p.m. Imagine that you have to follow this routine every day. You might forget. Yeah. So in case you forget, and then sometimes sex can be unintentional in quotes sometimes, and then you go in and then it happened. It might fail. Yes. You say, I've been taking the pill every day, but you forgot one day. Yes, it might fail. And then taking the emergency contraceptives. Now, some of the emergency contraceptives, example, like Postinor 2, it contains 2 tablets. Yes, which must be taken 12 hours apart. Yes, and if the person doesn't know and doesn't even adhere to this, it might fail. Or who knows, the day the person had sex, that's the day she ovulated. And by then the sperm has met the egg already. It can't do anything. The drug can't do anything. The drug is not meant to abort the baby. It's just meant to prevent their fusion. Yes. And then let's take one thing that when you go to a doctor, the doctor asks you, do you take any other medication? You get it? It's a question that every doctor asks when you go for consultation. Do you take this medication? Are you taking another medication? And imagine a lady taking a contraceptive pill. It's also on another pill. Yes, and we call something drug-to-drug interaction. Now the liver is responsible for breaking down medications, the drugs that we take. And in this liver are enzymes. Yes, and the enzymes, their action can be fast regulated by some drugs. That means they induce the enzymes. Now imagine you take such drugs with a contraceptive pill. Now if you take such a drug, it will induce the liver to break down the contraceptive pill very fast. So it won't get the time it needs in the body to have its effect. Yes. And some women actually, they have this kind of absorption problems. Their body cannot absorb some things they take, like food.
taking.
Yes.
Okay.
So in this condition, they can't. Though yes, they've taken the contraceptive pill, but their body can't absorb it. Some of these conditions are inflammatory bowel diseases or even Crohn's disease. Yes. So in this condition, the woman
Contraceptives will just fail you.
It will just fail you.
Right.
You've taken it, but it will fail you. Yes.
We've been talking to Lorisha Atisho. She is a 4th-year nursing student, and the topic is contraceptives. We'll be right back after this. Welcome back. This is still White Coats Diaries here on TEK TV, and I have been talking to Lorisha Atisho. She is a 4th-year nursing student, and we have been discussing contraceptives all this while. We are back. Yeah, so before we went, we talked about why contraceptives fail, and you gave us a lot of reasons why it happens that way. Now let's look at the effects taking contraceptives have on an individual. Yeah.
Yes. Thank you very much for the question. Now, every drug has its own side effects.
Okay.
Even para has its own side effects. Yes.
Okay.
Yes. And so does the contraceptive pills. Now, one major thing it does is it changes the menstrual cycle.
Okay.
It changes the menstrual cycle. Now, every woman would like to be in control of her body. She knows when this is coming, or I should prepare for this. But then in this case, now, the drug you've taken is altering the processes of the body. So you can't predict when next your period is coming. So you'll be somewhere and then surprise, I'm here. You can't do anything.
Wow.
Yes, it's in. And one other thing is headaches.
Okay.
Yes, it causes headaches sometimes. Okay. Yes, there's breast pain sometimes. Yes, depression. Yes, a whole.
Now about the menstrual cycle, ladies like to know when they are going to menstruate so they can prepare. Like if that day you have to get a pack of like sanitary pads in your bag before you move, you prepare. So now that you're taking contraceptives, you don't know when it's coming. How does it help the females in that condition?
In this condition, you see, every woman has let's say on the average, every woman has a 28-day cycle on the average. Okay. Yes, and you can monitor your cycle actually. If let's say you are part of the 28 days group, you know that on day 14 or +2 or -2 on that day, you are sure there's a release of an egg. Okay. Now, on the ovulation day, some women can actually know when they are ovulating. Okay. Yes, there's this one-sided pain you feel that shows that there might be an egg releasing from that side of the ovary. Yes, or there's this breast tenderness you feel, or this cramps, this lower back pain or something you feel. And one thing that happens during ovulation is that there's increased libido. Okay. Yes, so during that time, some women know, I'm ovulating. Okay. Yes, so when you're able to monitor such, you know that yes,
it means if you are on contraceptives, you have to be conscious of these signs.
Okay, you have to be conscious of these signs. You know that you are ovulating. Yes, it pushes the the menstruational period a bit forward or backwards, or it might maintain it that way. You can still monitor it to know when the next period is coming, or to be safe, just keep a pack in your bag always.
Yeah, yes. Every single day.
Yes, it's in your bag.
Now, the side effects you mentioned, are they all short term, or there are some long term side effects that you would want us to know?
I don't think they are long.
Okay.
Yes, they are all short side effects. Okay. They are all short side effects. Now, for the menstrual cycle that I mentioned, the changes. Yes, it might change it for 1 or 2 months or 3 months. Then you are back on track. Okay. See, the body was programmed in such a way that no matter what you do to it, it comes back on track. When it comes back on track. So after 1 or 2 months or 3 months, it comes back on track again. So far as you stop using it for some time, why not? The body returns to its normal functions.
Reason I ask the long term is that some people think that contraceptives have a relation with breast cancer as well as infertility, among others. Yeah. They think that is a long-term effect of contraceptives. So how true are all these assumptions that people have?
Okay, thank you very much. Now let me take the breast cancer. Now, there are so many risk factors for breast cancer now. Okay. There are so many risk factors. Now, compared to you being on contraceptives, that's changing something in your body that's meant to be on its own, regulating on its own. You are changing it. And somebody just maintaining as it is. you see that there's a slight increase somewhere. Yes, so you are at a slight increase. You are at a slight increased risk of cancer.
Okay.
Than someone who
It's
is
not.
actually not taking it and is free from it. Yes.
Okay, so it's not like it's causing it,
No.
but it has
No.
some relation one
Yes.
way or the other.
Yes.
Oh, great.
Yes, and taking the infertility for as one also another, people think is a side effect. Now,
Yeah, infertility.
yes, for some an example that I'll use is the IUD, the
Okay.
intrauterine device. Now, what it does is that it changes the environment of the endometrium of the womb, such that a fertilized egg cannot even implant.
Oh, okay.
Yes, it cannot attach itself to the uterus so that it grows. So you see that when it's there for a long time, as it just sloughs off the lining of the womb, it sloughs it off every time. So the lining becomes very thin, very, very thin. So imagine that somebody has used this for a long time. The lining of the uterus has become very thin, and a fertilized egg can't implant itself or attach itself to the womb very well.
Yeah.
Yes, for such a person, it might affect your fertility. So you have to wait for a long time, and then as the body repairs itself, or if it's an irreparable damage, it can just affect you. Really. It can't. A baby can't really stay there for long.
Wow.
See, as it attaches, it comes out.
It comes
As it
out.
attaches, it comes out. Yes.
Okay, Larisha, it's been great having you. We are wrapping up. Is there anything, any word of advice for the young people watching or anybody at all about contraceptives? Yeah.
Yes. One advice I'll give is that yes, there are so many methods of contraception right now. So many of them. Yes. So what you have to do is to talk to your doctor or a midwife, a certified midwife. You can work. You can walk into any clinic, any family health planning center. Talk with them. They will help you get one that is right for you. Yes, they will advise you, educate you on their family planning methods, and then give. It's called informed decision. You will choose one that is very good for you. Yes, that's my advice.
We've been talking to Larisha Atisho. She is a 4th year nursing student. Yes, she's in her final days and she has been really educating us on contraceptives. On the flip side, today we have a quote by Mahatma Gandhi, and he says that it is health that is the real wealth and not pieces of gold and silver. And so remember to always stay healthy. You have your health tip for us today?
Yes.
Okay, you want to read it out?
The same as I don't know.
It's almost the same. That's all we have for you today on White Coats Diaries. Remember to follow us on Instagram, Facebook, and Twitter at WCDGH for regular updates. And so until the next episode, keep the smiles alive and stay healthy. My name is Antoinette Enchi.